and made it as safe as it is. And we think it is quite safe, in part because the operation's short and simple, with minimal blood loss and minimal effects on the heart and lungs. So very few of our patients need to be like, you didn't have to be in the intensive care unit?
No.
Right. And you were home the next day, is that right?
Oh, yes.
Yeah.
And, you know, another thing is I had sleep apnea. I still have a sleep machine, and I still use it, but I don't have to.
Mm-hmm.
And I had an oxygenator, and my oxygen levels kept dropping all the time. I have it, I use it, but I don't have to. My oxygen level is maintained around 95 with or without the machine.
That's great.
So I think this surgery, this gastric bypass, this mini-gastric bypass surgery is just fantastic. It's just, you know, I'm really, I am
Every
really,
time you say that, you get $20.
I am really sold. It's just been now, you know, I had my arm twisted to get in here. She did it.
Really? Is that true?
That's right. I had
no
my
kidding, I
arm
didn't
twisted
know
to
that.
to have that surgery. I resisted it. I didn't want it. I didn't think I needed it. But I finally agreed to it and committed to it. And I have had no...
Now, since you have agreed to her advice on that, have you gotten a little bit less thick-headed? Do you agree to her advice on lots of other things now?
Not hard.
No.
I think men are like that. You can be right a couple. I don't care. I still.
You know, I must be doing something right. We've been together 44 years. And our life right now is as good as it gets as far as I'm concerned. We've done, you know, we've had a few setbacks, but, you know, health setbacks.
Do you mind if we talk about that? Can I ask you about the? Is it
Go
okay to
ahead.
ask about your colon cancer?
Okay, I've had, on July 31st, was diagnosed with colon cancer, and they removed the ascending and transverse parts of the colon. They hooked up that small intestine to the colon, and the doctor the surgeon who did that, you know, I told him I had this mini-gastric bypass, and he says, "Oh my." And then afterwards, he says, "Hey, that mini-gastric bypass was great."
What was that?
Yeah, it was great.
That's got to be worth $40.
And this,
I got to terminate the interview. I can't afford it anymore.
my surgeon for the colon surgery was a very compulsive, detailed, and he was one sharp cookie. And to have him say that, I think, speaks well of Dr. R. And the other thing, I still can't get over how much research and stuff that you have to go through to get that commitment. And, you know, that reflects your level of commitment. I don't know if you guys resent having to fill out all those forms like I do, like I did. You see,
$20.
but this gives him the confidence to know that you, as an individual, are committed. If you're going to go through all of that, the chances are pretty good that you are going to lose the weight.
I think that's really important, and we do this, and we get a lot of people who just hang up on me. You know, they call, and a lot of times they're professionals. They'll say, you know, I'm a physician or a nurse or something like that, or, you know, I'm an attorney, I'm a professional, I don't have time to do all this. And then we have other people who are like from Chicago, and they'll call and say, "Hey, Dr. Rutledge, listen, I'll bring you cash.
Oh,
Don't worry about this other stuff, right? I just bring you cash." I go, no. They go, you don't understand. I'm going to bring, dollar bills, $100 bills, and you have to say nothing to nobody, okay? I went, no. But people say, I want around this process, that terrible packet process. And we hear people, call up, and they'll be incensed. Who do you think you are? I'm not going to write 10 pages about this stuff for you. And I try to be nice about it. Look, I apologize, but no way. And I think one of the reasons is that the mini-gastric bypass is a very powerful tool, but it also has some risks. And we talked a little bit about this yesterday, but I'd like to re-emphasize it. Long term after the surgery, you can get problems. Now, we think we may well have improved your life, maybe even...
You have substantially improved our lives.
Right, and we think that, but on the other hand, there are risks to you. One of the risks is you can get an ulcer or gastritis or something.